lung diseases, and strokes. These can be prevented. But we do not spend any money on prevention in this country. Only 4 cents of every dollar is spent on prevention and public health. Only 4 cents of every dollar. When I see a Medicare patient for an annual physical, which includes preventive care, for females who need to have pap smears and breast examinations, I cannot bill for prevention. I have to bill for a regular office visit and code it as if I saw them for their hypertension or their diabetes. Because Medicare does not pay for prevention. And so we have a real problem in this country where we're focused on treating diseases and not treating or preventing diseases. And so we spend a lot of time doing quantity of care and not quality of care. Doctors want to focus on prevention and doctors want to focus on wellness. In my practice when I started, I had, my motto was improving healthcare through diversity. That diversity meant that if you came to me and you were sick and you had a disease, I would diagnose it and I would treat it properly. But I also focused on prevention, I focused on community service, and I focused on diagnostics. So I wanted to give a comprehensive treatment, but most of my time is spent on treating diseases. You don't get enough time, you cannot bill adequately when you're sitting down talking with a patient about prevention. Talking to a patient about cigarette cessation and helping them to understand how they have developed a habit is not reimbursable. They want you to talk about it, but most often it's as the patient is walking out the door after you've written your prescriptions and told them what specialists to see, then you say to them, and oh, by the way, I want you to quit smoking. So we don't get an opportunity to spend time on prevention. Again, the system rewards the quantity of care rather than the quality of care. There have actually been studies to show that if you have a heart attack and you have insurance, you're as more likely to die as the person who doesn't have insurance. And part of that is because we do not look at what all the time is effective in treating a condition. In the New Yorker, there was an article about McAllen, Texas spends twice as much as El Paso, Texas in the improvement in health. So we have these disparities in care, and we need to become more uniform in the way that we treat patients. Finally, you've heard about comparative effectiveness research. The president is interested in allocating funds for this so that we can begin to compare the effectiveness of certain treatments. Less than 1% of our healthcare spending goes to figuring out what treatments are most effective. It can take up to 17 years for research to find its way into an exam room or operating table. The goals of reform should include research to identify what works and facilitate rapid implementation of what works in our practices. So this is an overview of part of the problem, but then I'd like to just kind of bring it home, because as we talk about statistics, as we talk about numbers, people get lost in that. We forget to see the faces of the people who are having difficulty. I have for you a patient that I will call IJ. She's 58 years old. She's been in my practice for 5 years. She has hypertension and she has seasonal affective disorder. She's on several medications, but one of the medications she's on is Lexapro. Lexapro is an antidepressant. It's one of the newer antidepressants. She's been on several antidepressants over the years. But this time, when we started her on Lexapro, she actually began to feel like a human being. Those are her words to me. Well, IJ is now 58. She has worked for a small business person who did not provide health care for her, but her husband had health care, and he was employed, and as long as he was employed, she was on his plan. Well, her husband retired, and he's now receiving Medicare. Medicare does not cover the spouse, and so now IJ does not have insurance. And so she went to the open market to try to find out how much it would cost for her to have a health insurance. She is a very dignified lady, an intelligent person. And when she looked on the open market, the best she could find at 58 years old, hypertensive and seasonal affective disorder, was $675 a month. She can't afford health care, but she's always had health care before her husband retired. And so now she's reduced to coming to my office once a week, once a month, to get samples of her blood pressure medications and samples of her medicine for her depression. This is a dignified, I was seeing her initially about every 3 or 4 months, and then twice a year as things stabilize. She now has to come to my office, take time from her work, and come to pick up samples. There is no dignity in that. As a private practice physician, I provide health care for my employees. I told you not enough people are covered. IJ represents one of those. But it also costs too much to provide health care in this country. My son works as my administrative assistant in my office, so I asked him to just run some numbers for me, knowing that I was coming here this evening. What does it cost for me as a primary care physician, the lowest on the totem pole of reimbursement in this country, to provide health care for my employees? In the months of January through April of '07, my medical insurance costs for my employees, and at that time, I still have about the same number of employees, but about 7 of us were on the insurance because others were on their spouse's insurance. That helps me out a whole lot. But anyway, in '07, I paid $9,561.85 from January to April for health care for my employees. In '08, January through April of '08, I paid $11,427.93 for health coverage for my employees. This year, January through April '09, I have paid, because this April has passed, I have paid $19,567.29. It costs too much to provide health care in this country. So with that, I will close. So hopefully that you will see that these numbers have been subtracted to their least denominator. Is people who are suffering because of health care costs in this country and lack of access. Thank you very much.